Have you ever wondered what gives your face its shape and protects one of the most important organs in your body? The answer is your skull and facial bones. The human skull is a strong framework made up of 22 bones. These bones work together to protect the brain, support the face, and help with important activities such as eating, speaking, seeing, hearing, and breathing. The upper part of the skull, known as the cranium, surrounds and protects the brain. It acts like a natural helmet, shielding the brain from injuries and impacts. The cranium is made up of several bones, including the frontal bone in the forehead, the parietal bones on the sides and top of the head, the temporal bones near the ears, and the occipital bone at the back of the skull. The lower portion of the skull contains the facial bones. These bones create the structure of the face and support important features, such as the eyes, nose, and mouth. The cheekbones, called the zygomatic bones, help form the shape of the cheeks. The maxilla, or upper jaw, holds the upper teeth and supports the nose. The mandible, or lower jaw, is the only movable bone in the skull and allows us to chew, speak, and open our mouths. One of the most important functions of the skull is protection. The eye sockets protect the eyes, while specialized bone structures shield the ears and support the nasal passages. Without these bones, delicate organs would be far more vulnerable to injury. The skull also provides attachment points for muscles. Facial muscles allow us to smile, frown, laugh, and express emotions. Jaw muscles attach to the skull and generate the force needed for chewing food. However, like any part of the body, the skull and facial bones can experience problems. One common issue is facial bone trauma. This can happen during accidents, falls, sports injuries, or physical impacts. When facial bones such as the nasal bone, cheekbone, or upper jaw are fractured, the face may become swollen, painful, and misshapen. In severe cases, vision, breathing, or chewing can be affected. Another condition that can affect the skull is bone density loss. Healthy bones contain a dense internal structure that provides strength and support. As people age or experience certain medical conditions, bone density can decrease. This process causes bones to become more porous and fragile. When bone density loss affects the skull and facial bones, they may become weaker and more susceptible to fractures. Maintaining healthy bones is important throughout life. A balanced diet rich in calcium, vitamin D, and other essential nutrients helps keep bones strong. Regular exercise, especially weight-bearing activities, also supports bone health and strength. The human skull is far more than just a collection of bones. It is a remarkable protective structure that safeguards the brain, shapes the face, supports the senses, and allows us to perform everyday functions.